You know, I've really loved being a neurologist all these years. The brain is still the most fascinating organ in the body, I think, and we still have a lot more to learn. I wish I were just beginning this path, but it's been fantastic. And stroke in particular has been so amazing because as you know, early in my career, we really weren't able to reverse strokes, and so I got to see that change. And once you're standing in the room watching a procedure where the patient had been paralyzed and they start to move that arm and leg and talk, you're pretty much hooked on doing that again. And so I think that's why I have wonderful partners and nurses who support this program, and they do it 24/7, 365, and often these things happen in the middle of the night. So you've got a whole huge team of nurses and physicians who are there anytime, day or night, but they get to see this fantastic, miraculous, really, change in the person's outcome, and it's well worth it. When I started taking care of stroke cases in the 80s, there was really nothing to do acutely. We tried to take great care of them medically. We controlled high blood pressure, which, as you know, is a continuing threat for both heart disease and stroke. But we really couldn't do anything to stop the stroke in its tracks. In the early 2000 era, we began to test mechanical ways to pull the clot out of the artery in the brain. Basically, stroke is a plumbing problem. You've got a blockage in an artery, and you really need to get rid of it as soon as possible. And when you can do that quickly, oftentimes you can restore function, either altogether normal function or greatly reduced disability. You know, the American Heart Association has done such an amazing job of public education for heart disease that I think everyone in this room tonight and everyone probably in the United States understands that when there's an elephant sitting on their chest, they need to call 911. We are not there yet with the public awareness of stroke symptoms and signs. One of the problems is, of course, that because the brain is the affected organ, people experiencing stroke symptoms often don't realize what's going on. So it's a bystander, a family member, someone near that person who has to identify the symptoms. The reason why it's so important for every person to know the signs and symptoms of stroke is that this treatment is time dependent. So the earlier we're able to get that patient to the right place and institute therapy, the much better outcome we will have. And so it's really critical, the public education that the Heart Institute carries out and the American Brain and Stroke Institute carries out, and in partnership with the American Heart and Stroke Association, it's really a dynamite combination. The American Heart and Stroke Association is responsible for collecting all the best evidence there is. So they look at all the publications that have gone on worldwide, and then they publish guidelines so that we have professional standards to follow. Those are the basis for our standing protocols, for our standing orders, and people don't realize how much work that takes. But it takes a whole team of people who are staff at the American Stroke Association and a lot of volunteers who give their time.